Hello everyone. Today we are going to start the new lecture. It is the anterior lateral abdominal wall. In this lecture, we're going to discuss the muscles, the posterior view, blood supply, and the nerve supply of the anterior lateral abdominal wall. So the learning objectives here are to discuss the muscles of the anterior lateral abdominal wall, their origin, insertion, and the functions. We're also going to check and learn about the rectus sheath, blood supply, and the nerve supply of the anterior lateral abdominal wall. So let's start with all the layers that are present here. So starting from the superficial to deep tissues of the abdomen, it is divided into, firstly, we're going to look from going from anterior to posterior. So the very first layer is the skin. Then we have the superficial fascia. That contains the external layer of the adipose tissue, also called as the Camper fascia, and the internal layer of the dense connective tissue, which is called as the Scarpa fascia. Beneath the superficial fascia, we have the muscles, which is divided into two groups, the lateral abdominal muscles and the anterior abdominal muscles. After that, we have the transversalis fascia. Below it, there is any extra or posterior to it is the extraperitoneal fat, and finally, we have the peritoneum. So again, we're going to start with the muscles. The muscles of the anterior lateral abdominal wall are divided into two groups, the lateral abdominal muscles and the anterior abdominal muscles. The lateral abdominal muscles include the external oblique, internal oblique, and the transversus abdominis. The anterior abdominal muscles include the rectus abdominis and pyramidalis muscle. So let's start with the lateral abdominal muscle. On the figure right here, you see these red muscles right here. So it originates from the outer surface of the ribs 5 to 12. So you see this is the origination point of the external oblique muscle. So it's like interdigitating. If you put, it's like putting your fingers in the pocket on the side of each side of your abdomen. So these are interdigitating coming from here on each side. The insertion point is the linea alba. If you remind yourself, the linea alba is the basic tendon right here in the midline. So it is the insertion point of the external oblique muscles, and also the pubic tubercle and the iliac crust. So the part of it that is not inserting here, it's inserting over here in the pubic tubercle and the iliac crust on either side. The nerve supply for the external oblique muscles is from the intercostal nerves T7 to T11, subcostal nerve, which originates from T12, and the iliohypogastric nerve. And the action is it flexes and rotates the trunk, compresses and supports the internal viscera, and assists with the expiration. The next muscle we are going to look at is the internal oblique muscle. It is a part of the lateral abdominal muscles. And if you look here, it originates from bottom and go up to top. So the origination point is from the anterior iliac crust, the thoracolumbar fascia, and the lateral third of the inguinal ligament. So it goes from here. This is all the origination point of the internal oblique muscle. Insertion is the inferior borders of the ribs T to T, sorry, interior ribs from 10 to 12, and the linea alba, the rectus sheath. So this is the internal oblique muscle. So external is coming from top to bottom or superior to inferior. It is similar to the external oblique, but it's on the internal side. So it goes from bottom to top. The nerve supply again is from the intercostal nerve T7 to T11, the subcostal nerve T12, and iliohypogastric nerve. And what are the actions? Again, the actions are that it flexes and rotates the trunk, compresses and supports the internal viscera, and assists with the expiration. The last muscle in the lateral abdominal muscle is the transversus abdominis, and it is the deepest of all three lateral abdominal muscles, and its fiber runs horizontally. So the transversalis fascia, it lies underneath this muscle. So lateral abdominal muscles, and then there is the the transversalis fascia. The origination of this muscle is the inner surface of the costal cartilage of the rib 7 to 12, iliac crust, and thoracolumbar fascia, and the third of the inguinal ligament. So it has the only muscle on the lateral abdominal muscles that has the fibers that runs horizontally. The insertion point is the rectus sheath. So if you look here, all three or four muscles of the abdomen that are majorly present that you can look at. So you have the external oblique that coming from here, internal oblique which is beneath the external oblique, and it goes from bottom to top. And below this, there is the transversus abdominal muscle. So you look at, it's like wrapping around the abdomen. So the nerve supplies from the intercostal nerve T7 to T11 and the subcostal nerve T12. The action of this muscle is that it flexes and rotates the trunk and compresses and supports the internal viscera and assists with the expiration. So if you have noticed this pattern right here, the internal oblique, external oblique, and the transversus abdominis, they all have the same actions. They have their flex and rotate the trunk, compresses and supports the internal viscera, and assist with the expiration. Now we're going to look into the anterior abdominal muscle. So this is the anterior group of the anterolateral wall. The very first muscle that we are looking at is the rectus abdominis. So this is basically what you call as a six-pack that you see in the people who goes to gym and they have very low transcutaneous fat on their abdomen. So this muscle is called the rectus abdominis. These are the pair of long straight muscles. They run vertically and they have right and left parts which is separated by the central linea alba, and each muscle consists of four parts which is separated by three bands of tendons, basically called as tendinous intersections. So because of these tendinous separations or intersections and the linea alba in the middle, you get that six-pack view. The origin is from the pubic symphysis and the crest. The insertion is into the xiphoid process and the costal cartilage of the rib 5 to 7. The nerve supply is the intercostal nerve T7 to T11 and the subcostal nerve T12. And what is the action again? It flexes the trunk, compresses the internal viscera, and assists with expiration. So, rectus abdominis muscle has a uh, sheath, which is called as the rectus sheath, which is created by the aponeurosis or the tendons, tendon-like structures of the three lateral abdominal muscles, which are the internal oblique, external oblique, and the transversus abdominis. So these these actually cover the abdominals, the rectus abdominal muscle. And above the arcuate line, we're going to look into that later. It is enclosed in the sheath below it, and the sheath is entirely anterior to this muscle. Hence, the whole muscle is going to be in direct contact with the transversalis fascia. So, above the arcuate line, which is basically the line running through the umbilicus, above it's going to be covered with the rectus sheath, both anterior and posterior. But when you come down below the arcuate line or the umbilicus, the anterior is going to be covered with the rectus sheath. The posterior is going to be touching the transversalis fascia. We're going to look that in detail in the coming slides. So here we're going to look at again, this is the transversus abdominis, which is beneath the rectus abdominis. So you see it originates from here and go all the way up here. And you see this basic linea alba in the middle and the tendinous intersection. So that is actually going to give it its six-pack structure or look. The last muscle for the anterolateral abdominal wall and into the anterior abdominal muscle group is the pyramidalis muscle. So this is the small muscle and it may be absent in 20% of the population, so it's not always visible. In 80% of the population you may appreciate it, but in the 20% of the population it is absent, and it is contained within the rectus abdominis sheath. The origination is from pubic symphysis and the pubic crest, and the insertion is the linea alba. And there is only one nerve supply to this muscle. It is called the subcostal nerve from T12. Action is that it tenses the linea alba and reinforces the lower rectus sheath. So now we're going to look at the rectus sheath. We're going to look at what is made up from and what are the muscular or the components of it. So it is a multi-layered aponeurosis, which is being durable, resilient, fibrous compartment, and it contains the rectus abdominis and pyramidalis muscle. It covers the anterior and posterior surface of the upper three quarters of the rectus abdominis muscle. So the upper three quarters out of four, it will cover the rectus abdominal muscle from both anterior aspect and the posterior aspect, and the lower quarter of its anterior surface. So basically, after the arcuate line or after the umbilicus, the aponeurosis crosses, interdigitate in the front. So the rectus sheath is going to cover it from the front of the rectus abdominal muscle. So the lower quarter of the posterior surface of the rectus abdominal muscle isn't covered with the rectus sheath at all. So instead, it lays directly on the transversalis fascia. I know it's a mouthful. Posterior surface of the rectus abdominis muscle. that is not covered by the rectus sheath. So it interdigitates around the rectus abdominis muscle. What is aponeurosis? So we need to differentiate that from a simple tendon of a muscle. So it is a sheath-like elastic tendon structure which covers the portion of the muscle belly and acts as the insertion site for the muscle fibers. However, the free tendon connects the muscles to the bone. So this is different from the normal tendon-like structures that we have on the muscles, because the other one is actually connect the muscle to the bone, but here there is no bone present, so it connects the insertion site for all the muscles for the abdomen. So it looks quite different than a tendon. It has a function of absorbing energy during the muscle movements. It is very rare for the aponeurosis to get injured, and it acts as a fascia. So how the rectus sheath is arranged. So again, it is made from the aponeurosis of the external oblique, internal oblique, and transversus abdominis muscles. The arrangement of this sheath interdigitate around the rectus abdominis muscle. So rectus abdominis muscle is very important for the rectus sheath arrangement. So depending on the location, the arrangement of the fibers or the arrangement of the aponeurosis is different. So let's start with above the umbilicus. So here you look at, this is the anterior aspect right here. This is the posterior aspect right there. The most anterior part is the skin. We have the camper fascia, scarpus fascia below it. So this one right here is the external oblique muscle, internal oblique muscle, and transversus abdominis. This right here is the rectus abdominis, both paired, and in between them is the linea alba. So now you look at the external oblique muscle, the aponeurosis, it goes all the way in the front of the rectus abdominis muscle. The transversus abdominis muscle, its aponeurosis go posterior to the rectus abdominis muscle and come down here and attach itself. But when you look at the internal oblique muscle, its aponeurosis actually divides into two lamina. So the first lamina is the anterior one that goes anterior to the rectus abdominis. The posterior lamina goes posterior to the rectus abdominis. Now remember this is above the umbilicus point. I have found another image, so with the colored one, you can understand it better. So this is in external oblique, internal oblique, and transversus abdominis. So you see in external oblique, the aponeurosis go anterior to the rectus abdominis. Internal oblique has two laminae, one go anterior to the rectus abdominis, one goes posterior to the rectus abdominis, and then we have um, the last one, which is the transversus abdominis muscle. So now we're going to look the one that is below the umbilicus or below the arcuate line. So below the umbilicus, the aponeurosis of all three lateral abdominal muscles. External oblique and its fascia, its aponeurosis. Internal oblique and its fascia, its aponeurosis. And transversus abdominis and its aponeurosis all goes in front of the rectus sheath. So that's how it matters that in the lower third after the umbilicus or the arcuate line, which is a division point, the rectus abdominis muscle is in direct contact with the transversalis fascia. And then below there is a peritoneum. So look at this colored image again. We have the aponeurosis of both external oblique, internal oblique, and the transversus abdominis. All three goes anterior to the rectus abdominis muscle, but this line right here, the yellowish line, it's transversalis fascia, and it goes posterior to the rectus abdominis. So let's look at the blood supply of the anterior lateral abdominal wall. It is divided into two layers, superficial and deep layer. So that's how the blood supply is differentiated. The superficial layer has three arteries: musculophrenic artery, superficial epigastric artery, and superficial circumflex artery. The musculophrenic artery originates from the internal thoracic artery, and it supplies to the superior anterior lateral abdominal wall. The superficial epigastric artery and the superficial circumflex iliac artery, superficial circumflex iliac artery, they originates from the femoral artery, and both of them supplies the inferior anterior lateral abdominal wall. The deep layer blood supply, first one is the superior epigastric artery. It is a direct continuation of the internal thoracic artery, and it runs inside the rectus sheath behind the rectus abdominis muscle, and it supplies the superior part of the abdominal wall. We have the inferior epigastric artery, and it is a branch or direct branch from the external iliac artery, and it courses through the rectus sheath and anastomoses with the superior epigastric artery, so it supplies the inferior part of the abdominal wall. So this is the deep layers. Then we have the smaller arteries, the 10th and 11th intercostal arteries, and the subcostal artery that supplies the lateral abdominal wall. Venous drainage is very simple. It follows the arteries having the same name, superficial veins around the umbilicus, and anastomose with the deep veins through the paraumbilical veins. In this final slide, we're going to look at the nerve supply. So the skin, abdominal muscle, and peritoneum are innervated by thoracoabdominal nerves, T7 to T11, that runs within the internal oblique and transversus abdominis muscle layer. The subcostal nerve, T12, excuse the typo right here, iliohypogastric nerve, L1, and ilioinguinal nerve, L1 as well. So these are the motor. The sensory one is the skin around the umbilicus is innervated by the T10 and the series of transversus dermatomal bands from T7 to L1. So with this slide, we're going to end our presentation or this discussion on the anterior lateral abdominal wall. Just a review, we discussed the muscles, their origination and insertion points, their blood supply, their innervation, and then we have looked in greater details about the rectus sheath. Thank you so much, and stay tuned for the later lectures on the gastrointestinal system. Thank you.